Welcome to Aging Insights. I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. Aging Insights is produced by the New Jersey Foundation for Aging to provide information and resources to boomers, seniors, and caregivers. The New Jersey Foundation for Aging's mission is to enable seniors to live with independence and dignity in their communities. We often hear people say, "I did not know where to call or who to reach out to." So today we'd like to explore those resource phone numbers that might be helpful to have. I am pleased to have Laila, Executive Director of the Middlesex Office on Aging and Disabled Services, and to have Laura Marx, who is the Executive Director of the New Jersey 211 Partnership. Thank you both for being here. You know, we get many calls in the office, and we always refer senior calls to the local county offices on aging. So I'm very pleased that you're here today, Laila. And I know May is Older Americans Month, and so I thought it would be helpful to kind of talk about the calls that you get and the services that your office and staff are able to offer callers. So can you give me a sense of what kind of calls you do get in your office?
We get a wide variety of calls, and usually the calls come in when people are in crisis, or they're, finally, realizing that a situation is about at the home or with their parents, and they need some assistance with it. Mm-hmm. So we have a wonderful I&A staff, which is information and assistance, and when the call comes in, it comes through our front desk, and then it's referred to one of our information and assistance people, and they'll do a brief intake to find out about the situation, determine the needs that the client is speaking about, mm-hmm. and then send out a referral, give them a few referrals to contact, or send out paperwork for different programs that they might be eligible for.
And can you just give our viewers a sense of some of the programs that you really have direct contact with in your office that you can connect people to?
We work together with the community and many different providers within our office, and we provide a resource directory that anyone can look up on the county website, or that can call the office that we can send out to. But within our office, we provide the senior meal program for people who would need a home-delivered meal, or would like to go and have socialization and have a congregate meal where they're sitting and have activities with people. We have the SHIP program, which is the state health insurance program. We have a county program of MCMAP, which is the Middlesex County Multi-Assistance Program. We have a GO program, which is Global Options, and the JACK program. And we have a myriad of smaller programs also. Ensure Seniors Are Nourished, where we provide 30 cans of Ensure to people if they qualify with a doctor's note, and there is some income guidelines with that. We also have Project Lifesaver, Project Medical Card, so there's a whole myriad of different available services for people in the community.
Okay. So let's break that down a little bit, because you really, there's so many services. So if we just want to look at nutrition services, mm-hmm. for instance, within Middlesex County, you mentioned home-delivered meals.
Yes.
And congregate meals. So mm-hmm. you must have several sites throughout the county for congregate meals?
Yes, we actually have 8 sites within the county, and they're located throughout the county. So we're in Carteret, Edison, Perth Amboy, Piscataway, South Brunswick, South Plainfield, and Sayreville. Mm-hmm.
And
Perth Amboy.
And Perth Amboy. Let's not forget anyone.
Yes, all 8.
All 8. And then is there transportation to get people to some of those sites?
Transportation is available within the senior centers, within the townships, and also the Middlesex County Area Transit Program.
So it's very nice. And not only are there meal programs, but you can help people get to them. Yes. And the Ensure sounded like a program. Would that be coupled with the home-delivered meals, or is that a standalone program?
It's a standalone program, and it's for people who really can no longer eat solid food. So you can, unfortunately, cannot be on a senior meal program and receive Ensure.
Oh, okay.
Because you are receiving, a hot, nutritious meal.
Mm-hmm. And I imagine that sometimes you get the caregiver, the person who's not the senior themselves. Mm-hmm. And so I know you mentioned your resource directory, but do you see their needs as different than a senior that's calling for themselves?
Well, many times they're very similar, and many times they're calling for a senior, or they mm-hmm. themselves are a senior and they're taking care of a more elderly parent. Mm-hmm. So they can overlap, but they can be distinct and separate. And we kind of handle them, the same way as we do any client. As I said, doing a kind of a brief intake, determining the needs, and then seeing how we best can assist them.
Mm-hmm. I think while we're talking about Middlesex County today, I think we need to recognize that there are 21 county offices on aging who may be called the Offices of Aging and Disabled Services, or the Office of Area Agency on Aging, or the ADRCs. Mm-hmm. So do you want to speak a little bit about some of your partner counties?
Well, each county is standalone and runs separate. There is a state guideline where each county needs to have a AAA office, which is the Area Agency on Aging. Mm-hmm. And with that, also each county also has become an ADRC, an Aging and Disabled Resource Connection Center. However, each county within itself is a little unique to meet the needs of the population within that county. So we all might have different titles and different services within our office or organization and how we're placed within that structure. But those are the two core components.
Yeah, I think you mentioned it before, information assistance, INA, kind of being that first level of response that somebody might get when they call the office.
Yes.
And so that's nice to know that that's available. I know we get calls in our office, and just this morning I got a call from a woman who was calling because her home was in foreclosure, that she had received her notice of the sheriff's sale, and she wanted to know how she could get assistance. So we've done programs in the past on foreclosure prevention. So I offered her the 1-800 number for Novadebt, but at the same time, I asked her what county she was in, and she told me the county, and I gave her the county Office on Aging number, because I think there are probably other services that could help her besides trying to deal with the foreclosure and the sheriff's sale. So it's really nice to know that the county offices on aging are there. And I know that you also have other responsibilities that are beyond services in terms of just assessing local need and planning.
Yes, and that comes in with our area plan contract that we have with the state. But all our programs really are, we're able to accomplish many of all our programs through the support of the Board of Chosen Freeholders. And also, we have a very active advisory council. And their input and participation is very valuable into assessing what the needs are of the seniors within our community in the county. Also, we are one of the most ethnically diverse counties within the state. So dealing with many different ethnicities and backgrounds and languages is sometimes a challenge, but we try and rise above it. And we have language translation. Our office has people who speak many different languages, and we try and address all the information as we can to the needs of the people.
Yeah, I was going to bring that up. I've always been very impressed at the multicultural staff that Middlesex County has been able to bring on board. So what are some of the languages, some of the calls that you might get? Spanish
is a very popular number of calls that come in. We have Spanish, we have Gujarati, we have a couple of different Indian dialects of people, we have Polish,
So it is a very diverse caller population that you deal with. And I just want to say, the number of young old that you have will be aging in place, and so you can obviously anticipate their needs. I think the county offices really do, I think, give the state information about where their service distribution really needs to go. So I think it's very nice that everybody can kind of design their system locally. Going back to caregiver calls, do you get a lot of calls for respite services?
We do, and we have a respite care coordinator that deals specifically within that program and dealing and helping the caregivers with their needs, and able to give them a little respite from their current situation that they might have. What
does respite really look like, though? I mean, is it somebody coming into the home, somebody going into a facility for a few days? What does
it's all of that all of that and the above. Each situation is assessed and looked at, and the needs of the person might be different also. Whether a person is just going away for a short, if they have a business trip that needs to be done, or if it's an emergency situation, or whether it's a planned vacation.
And since you mentioned there will be an assessment, I imagine you must have some clinical staff as well in terms of case management.
We have our case managers, yes, go out and conduct assessments. The assessments are done within our meal program also to ensure that needs are being met and that we get a full picture of what a situation might be.
Yeah, I think that the other thing that I've also noticed is different counties have the ability to support and underwrite the programs in different ways. And I have always had the sense that Middlesex County freeholders have been very supportive of the county services.
Extremely supportive, yes.
And to the extent that I believe there's support for some weekend meals and a reduction of waiting lists, is that correct?
Well, our county, I can very proudly say that our county has not had a wait list for meals in over 13 years.
It's wonderful.
And that is through the support of the freeholders. And we appreciate that fact, and it's for congregate and home delivered also that we have not had this wait list.
I think the Insure program is a little unique. How did you start that?
That was actually started with a grant from the AT&T Corporation back in the day, and we've been able to continue it. There is a cost share for the program, and it helps provide a little bit of nutrition for the people, as I stated earlier, that cannot no longer eat solid foods.
Right. I think it's just a nice combination. You really have quite a menu of services, pardon the food pun, but you really do offer an awful lot of things. And of course, across the screen, we'll be putting the phone number to reach your office directly, and later we'll talk about the hotline number. But because we really wanted to emphasize calling centers today, I'm very happy that Laura is able to join us from the New Jersey 211 partnership. I wanted to call it New Jersey 211, but you utilize partnership for a very good reason, I believe.
I think so.
So why don't you tell us how New Jersey 211 started?
Okay. Well, 211 is a dialing code, and it's also a program. And we have a companion website that's at www.nj211.org.
You might want to say that slower. Go ahead.
Can I say that fast?
Yeah.
www.nj211.org. And we began 8 years ago, so we're 8 years young. And the idea really came through the United Ways and the Alliance of Information and Referral Systems, which is kind of our accrediting oversight organization.
Is that national?
It's a national organization. And they went to the FCC because of these needs assessments that are done in counties. Usually the very first thing people say is, I don't know how to get help.
Right.
So they went to the FCC and said, wouldn't it make sense to dedicate a dialing code for health and human services? And the data was so, just so impelling that the FCC said, yes, I think this is a really good use of, one of 9 dialing codes. So just as you would dial 911 for an emergency, you can dial 211 anywhere in the nation for health and human service information.
And so it connects you. So if you call from Maryland, you're going to get a Maryland Resource Center. If you call in New Jersey 211, you're going to get a New Jersey-based service.
That's correct. So right now, about 90% of the nation is covered with 211 service. Last year, we took 16.8 million calls.
Just at New Jersey 211?
No, in the whole nation.
Oh, in the nation, okay.
But just as with the Area Office on Aging, 211 is very specific to in our case, our state instead of the county.
Right.
So we develop our programs based on the top needs of our callers, and we develop our partnerships, which is the partnership piece of that, based on the top needs of the callers as well.
So what kind of calls do you receive?
So the number one call we get is for temporary financial assistance, and of those calls, and that's emergency assistance, and of those, utility assistance is number one. About 58% of those calls are for utility assistance help. Number 2 is for housing, and that's in all 21 counties throughout the state of New Jersey. And number 3 depends on where you are in the state. So in South Jersey, health and medical needs are number 1, and in the north, it's mental health needs. And then food moves up and down depending on the year, at any given time. And I'm sure it's probably the same in the counties. And we see across the nation that those needs are pretty much the same.
Right. I was going to say you probably get calls for financial assistance as well, and food, and especially when the economy is so strained at a certain point. So when someone does call, whether it's for financial assistance or food, what's the next step in terms of, I've dialed 211, now what?
Okay, well, we have live people there 24 hours a day, 7 days a week, 365 days a year.
Really?
When Hurricane Sandy came up the coast, we were there. We sheltered in place, because the staff, needed to be there to answer people's requests for information and evacuation. So when people call, we are very similar to the INR folks at the county level. We do an assessment of what their needs are. Because everyone calls and they want you to write a check, really. That's really what their need is.
Yeah.
And there's very few people today who will write a check. So we need to kind of back up a little bit with them and just say, what is it that brought you to this point?
Right.
So they might say that they had a medical issue, they might have, a child care issue, whatever it might be. And then we'll look at those needs. And we provide a referral resource for aging. We always refer back to the county offices because they have the best information about what local services are. But it's not so easy for other
Right.
kinds of needs.
Well, you have a really nice PSA, so I'd like to show it to our viewers and then, discuss some of the things that come up with the PSA.
What do you do when you want help, but don't know where to turn? What do you do if you cannot pay the utility bill and feed your family? As someone with a disability, where can you get help in accessing services in your community? Where do you turn if your child is in trouble? When you need help but don't know where to turn to 211. 211 helps you connect with over 17,000 health and human services across New Jersey. You are not alone. 211's helpline is free, confidential, and answered live by highly trained information and referral specialists. 97% of all callers were satisfied with our service. We are here 365 days a year, 24 hours a day, on the phone and online. And our phone line can help you in over 170 languages. Need help? Start here. Dial 211 or visit nj211.org.
Can you give us a sense of some of your frequent callers whose language, English is not their first language?
Sure. Obviously, Spanish is our number one other language besides English. Right now, the number 2 is Jahardi as well, then Chinese, and then Arabic.
Really?
And that's really increased over the past year, and we see that as a very good sign that finally, 211's a little bit more recognizable now in the local communities. But we do use a service. We have Spanish-speaking staff that are there 24 hours a day. But for the other languages where there's not staff that speak, there's some that speak Italian and others, but they're not always available. We use a language line service that provides translation for 170 languages.
That's really amazing, so that's very helpful.
It's an incredible technology, and it's a real live person at the other end. So it is very much a regular conversation.
Yeah, you also have, I think, a very helpful website. So you want to tell us what's on your website?
Sure. The website, again, reflects the top needs of our callers and how people look for services at a website. So some people are very savvy at being self-serving. So there is like a little Google-like search where you can put in the word food, and you can see the 800 food pantries in the state of New Jersey, and you can narrow it down to your county or your zip code. But then if you're not quite so savvy and you're just kind of looking for, like, how do I approach this foreclosure issue?
I was going to say, that's a fine example. What would you tell the foreclosure caller that I got today?
Well, I'll talk about the website, and then I'll talk about the call.
That would be great.
At the website, there's we call them targeted resource pages. It's latest news for you. And those targeted resource pages are dedicated to people who want to learn about what the issue is and how to navigate the social service system in New Jersey. And of course, it's a little complicated here because there's 21 different ways of doing things. So we try to give the broadest idea of how do you find resources for foreclosure, what are the federal resources, what are the state resources, and then what are the local resources. So that's how we approach it at the website. And everywhere on the website, they can't find what they need. It says, please dial 211, or we give our 800 number as well. And if they then call, the way that we approach it is we, again, see what they've already tried to do. And a lot of the time, people just don't open their mail.
Open
it's their mail.
Mail.
So
Okay.
they're kind of in denial about what's going to happen next. So there are times when we'll just kind of encourage them to kind of go back and just open, get the strength to open the mail, because the bank might have offered them a resolution, but they really don't know. In other cases, they have tried. And then they need some advocacy, and there's very many resources in New Jersey that we can refer them to.
I think that's nice to know that there's the next level, and we always try to make sure when we offer somebody a phone number that we think that it really is going to be more helpful, then we don't want to send people on circling
right.
around.
Certainly.
I also noticed on your website there's a live chat feature. And how does that work?
The live chat is, there's the agent, just as we have a call specialist waiting for a live call, there's someone monitoring the website. And right now, if a live chat comes in, we'll be able to just respond to that person real time. And it's
So
they're
I'm
typing.
just going to get basic
Yeah,
here.
typing.
We're typing in the question, and should one anticipate a quick response, or is there a time factor?
It is a pretty quick response. It's more complicated because it's hard to chat, because conversations kind of sit on top of each other, and we might be responding, and now the person's asking another question. So again, always on there, especially if it starts to get complicated, or if the person sounds like they're in crisis, then we ask them to call us. We just ask for their phone number, and we can call them as well. Right. So it's not for everybody, but it's a great resource for an easy kind of question.
You mentioned that you see more mental health calls. And so do they present a unique problem to your staff?
No, I think that they've had very good training in how to handle mental health calls. We do have a lethality assessment, we call it. So if someone calls and they're truly in crisis, we'll kind of walk them through a set of questions to see if we need to refer them for rescue. If they're suicidal and they have a means and a method, that's not for our staff to deal with. We need the authorities there. If they need psychiatric screening center, we can make that warm transfer to the psychiatric screening center. We have a memorandum with each of them in the state so that we can, kind of hand off the caller until they feel safe, and then we get off the call, and now they're in the hands of the professional again, or we can give mental health resources. And we actually stay on the phone with them until that transfer is complete. Yeah. So, we will call the psychiatric screening center and say, my name is Laura, and I have Mary Smith on the phone. Right. And Mary is blah, here's the issues that she's presenting with. And then they'll be like, oh, thank you very much. Hi, Mary. And then we just step back.
Off. Right. It's nice not to necessarily have to give them another phone number to call, because obviously they're distressed.
That's right. That's right.
I think that makes perfect sense.
And we can do that as well when seniors call. I'm sure you find the same thing, because if we see or sense that someone's having a hard time writing down the telephone number, or if they have a traumatic brain injury or something, we can offer to go ahead and just make those calls with them.
Yeah, I think, and you kind of bring up a new point. We really didn't talk about the types of calls that you might be getting from the disabled population now, Laila, now that the name is a little more encompassing. Do you see a change in your caller base?
For some younger disabled people calling the office, our MCMAP program, we've kind of
Say
encompassed.
what that is again.
The MCMAP program is the Middlesex County Multi-Assistance Program, and we can, have assisted people who are under the age of 60 who need assistance and are physically disabled with that program. And we do have staff on hand that can answer questions regarding, the disabled population and the connections that can be made from our office, the referrals that can be made.
So when you talk about assistance, are we talking about a personal assistant staff person that goes into the home for the person that's disabled?
So, well, we have several different programs, the MCMAP program being one. There's also the PASP program, which is the Personal Assistance Services Program, which is a state program. And each one's a little unique, but each one can assist and look at the needs of what is needed for that client.
Another program that you mentioned, since I really want people to have a full sense of what they can approach all of their county offices on aging offices are the SHIP program, where I would say that we're, out of tax season since we're in May, and we're really looking at things. But the insurance questions always come up, I think, in terms of people looking at their Medicare claim statement and different things like that. So can you describe maybe a typical assistance that a SHIP coordinator might offer?
Well, the SHIP coordinator is there to answer questions and to give information as to what is out there and what services people are entitled to.
Insurance-wise?
Insurance-wise, yes, absolutely, insurance-wise. And they're not there to make the decision for the person. It's up to the person to make the decision. So it's really kind of a layout of the different options that are available. And it's volunteer-based. We do have staff on hand who are also SHIP-trained volunteers within our office. And currently, right now, it is a little quiet. Open enrollment near the end of the year is when we get very busy with the different SHIP calls coming in. And we have partners within the community. And we have also one of the largest numbers of volunteers within the state to help the seniors within Middlesex County.
So they don't necessarily have to come into your office. They can go to probably one of the many senior centers throughout the county.
Absolutely.
So I think it's very nice, because sometimes it can be very confusing to look at what's being offered when, as you say, for open enrollment, or to understand a claim that comes in. And I imagine that sometimes people are questioning some of the items that are actually on their claim statement.
Absolutely, yes.
So, you know, it's nice to have someone else sift through those. Now, you take calls, but your office takes calls from what time to what time?
Our office is open 8:30 to 4:15.
4 through 15. So it's kind of nice to see the 24-hour assistance that New Jersey 211 can offer, and how it might complement your services even after hours. So I think that's kind of a nice thing. I mean, do you have a sense of, as you mentioned, Laura, that when you get calls from seniors that you're frequently kind of patching them through or making that connection?
Certainly, certainly. And we just happen to have a great relationship with Middlesex County as well. So we have a nice array of services that are updated pretty frequently from the county to really be able to give us those kind of after-hours resources back. But always saying, that at 8:30 you can call the county yourself and, get some further information.
Right. I think that's very helpful. And I know you have New Jersey 211 Ride. No, what is it called? New Jersey
NJ Find a Ride.
NJ Find a Ride. So just give us a brief description about that.
It's a website where you can search for transportation options in the state of New Jersey from any address. So from your home address.
Any age,
any person. And you can do it from your home address to the doctor, and you see what the options are. So whether it's public transportation, access services, shuttle services in the county, they'll come up.
Well, I think that's really wonderful. I'd like to thank our guests, both of you, for being here today and sharing your time with us. Aging Insights is produced by the New Jersey Foundation for Aging. We hope you learned a lot from today's program. To make donations to the foundation or to sponsor Aging Insights programs, you can go to our website at www.newjerseyfoundationforaging.org, or you can call our office. We'd be happy to speak with you. Our office phone number is 609-421-0206. Also, let us know if there's some topics that you think would be interesting for future programs. We want to remind you to find out about senior service or disabled services in your area, to contact your county offices on aging, also known as the Aging and Disability Resource Connection in your county. You will see a list of their numbers on our website, or you may call the state hotline number, which is 1-877-222-3737. And if you dial it in Middlesex County, you will get the Middlesex County Office of Aging and Disabled Services. Thank you for watching this episode of Aging Insights, and remember, aging is everyone's business.